Welcome to our patient education program on rotator cuff repair. Your surgeon has recommended you view this program to learn more about your upcoming rotator cuff repair surgery. If necessary, you may stop and start this presentation at any time by clicking the pause button. Please contact your surgeon with questions you have regarding this presentation or your surgery via the Signature Healthcare web portal or by calling our office at 508-565-3055. The shoulder joint is surrounded by muscles and tendons that allow for movement and stabilize the shoulder. The rotator cuff is a series of 4 tendons that allow for reaching and rotation of your shoulder. If one or more of these tendons gets worn, frayed, or torn, surgery may be recommended to reattach these tendons to the humerus bone. Your surgery will be completed in the operating room on an outpatient basis at Brockton Hospital or the New England Baptist Outpatient Surgical Suites in Dedham, Massachusetts. The address for Brockton Hospital is 680 Center Street, Brockton, Massachusetts, 02132. It is important to remember that operations are not done at 110 Liberty Street, where your normal office visits occur. Depending on your age and health, you may need pre-surgical testing. Our scheduling staff will arrange all required testing on the day prior to your surgery. On the day of your surgery, your arrival time will be about an hour and a half prior to your scheduled surgery time. In the hour before surgery, you will need to fill out paperwork and meet with the anesthesiologist. Our staff will also prepare you for surgery. Many patients are offered a nerve block in their arm before surgery. This procedure is performed by your anesthesiologist. After receiving medication to help sedate you and keep you comfortable, the anesthesiologist will inject a local anesthetic near the lower part of your neck to numb the arm and to help control the pain during and after your procedure. This can help reduce the need for narcotic medications after the surgery. You will have the opportunity to discuss this option with the anesthesiologist on the day of your procedure. If you are not a candidate for a nerve block, you can often use long-acting numbing medications in and around the shoulder that can numb the pain for over 12 hours and reduce the need for post-operative narcotic medications. Your surgery will last anywhere from 1 to 2 hours depending on the amount of repair required during the procedure. During this time, your family member will have time to fill prescriptions given to you by your surgeon. You will spend about an hour in the recovery room, and family members will be able to see you generally within 30 minutes after you arrive in the recovery room. Remember, you must have a ride home following surgery. You will not be able to drive yourself home. Once awake from surgery, you'll be wearing the sling and potentially an ice gel wrap that was fitted to you in the orthopedic office during your pre-operative visit. Nurses will use your IV to give you any anti-nausea or pain medication that you may need. Once you start drinking fluids, your IV will be removed. You will need to either wear or bring comfortable clothes with you to the surgery. These clothes must be easy to put on and easy to fit over the sling. A loose-fitting, extra-large top that buttons up the front is ideal. Another option is an extra-large sweatshirt that you can pull over your head that fits over the sling. Pull-up pants without zippers works the best for pulling on and off with one arm, and secure-fitting slip-on shoes should be worn. If you are a patient who uses an inhaler for asthma or any other reason, bring that to the surgery as well. It is imperative that you bring the equipment given to you at your pre-operative visit. This equipment includes the abducted pillow shoulder sling. The sling will be worn for different durations depending on the extent of your rotator cuff tear. For patients with a small or medium tear, meaning the rotator cuff tear is less than 3 centimeters, you will wear the sling for 3 weeks. For patients with a large or massive tear, meaning the rotator cuff tear is greater than 3 centimeters, you will wear the sling for 4 to 6 weeks. If you also have an ice gel wrap, this equipment should also be brought to the day of your surgery. Please do not break the seal on the packaging or use the equipment before the surgery occurs. Remember to bring all this equipment to the day of your surgery. When you return home from surgery, you should use as much ice as possible. It is used to control the pain and reduce the swelling. A bag of frozen peas works very well and can fit nicely over your shoulder. Remember to keep a cloth barrier between the ice and your skin at all times. If possible, ice your shoulder several times a day for 20 minutes each time, taking an hour break between icing sessions. If you have a nerve block before surgery, this can last anywhere from 10 to 20 hours. You should begin to take your pain medicine as soon as you feel the nerve block wearing off. Do not wait until you are in a lot of pain before taking the medication, as it takes at least 30 to 45 minutes to take effect. Take your pain medicine only as prescribed on the bottle. Narcotic pain medication will most likely be prescribed by your surgeon for the first few days following surgery. Do not take these medications any more frequently than directed. Your surgeon will let you know if supplemental medications such as Tylenol, Celebrex, Meloxicam, ibuprofen, or naproxen can be used. Do not drink alcohol while taking narcotic pain medication. Your reflexes may be impaired, so do not drive or operate machinery while taking narcotic pain medication. You will be provided with instructions on when and how to change bandages after the surgery. These instructions will also include information on when you will be allowed to shower. This is typically the 4th day following the surgery. Sutures or stitches will be removed at the first post-operative appointment. These appointments are scheduled between 10 and 14 days post-operatively. You may see some soaking of the bandage immediately following your surgery. This is normal. You may also see some bruising around the area or some slight swelling in the operative arm or hand. These things are also normal. Please call our office if you experience any of the following conditions after surgery. Pain that gets significantly worse despite using pain medication. A fever greater than 101.5 by mouth, expanding redness, pus, or a malodorous smell from your incision. If your dressing continues to be saturated with drainage or blood, significant nausea or vomiting from your pain medication, or numbness in the arm that returns after the nerve block is worn off. If you experience any of these conditions, please call the office at 508-565-3055. Our staff can assist you with adjustments to your medication and help you determine if a more immediate follow-up with the physician is required. If you reach our office after hours, you will be directed to the on-call physician. Your shoulder immobilizer, or sling, should be worn at all times unless undertaking gentle hand, wrist, or elbow motions to help keep these joints from becoming stiff. The small foam cushion between your arm and your body must be left in place at all times. If there is a ball attached to the sling, this can be used to exercise your fingers to minimize the swelling. Typically, the sling is worn for 3 to 6 weeks, depending on the extent of your tear. This should only be removed for showering or is otherwise directed by your physician. You may not use your operative arm to reach or lift any objects or to support any amount of body weight until your surgeon instructs you to do so. Return to work depends on your type of employment and can be discussed at your post-operative appointment. If you are using a mouse or a keyboard after surgery, do not move your arm away from your body to reach this equipment. Protect the rotator cuff repair. It is important that you do not reach, support your weight, or push off with the operative arm. It is very important to remember that the rotator cuff surgery is not easy, and it takes a considerable amount of time for the tendons to heal. Even if you are feeling better, you will not be able to reach or push with the operative arm until your surgeon or physical therapist instructs you to do so. If you walk your dog, hold the leash in your non-operative hand. Dogs love to pull on operated shoulders. On the 4th post-operative day, you'll be able to remove your sling for showering purposes. Once in the shower, bend forward and let your operative arm hang freely like a dead weight. Do not attempt to raise your operative arm. You can then reach under your operative arm with your non-operative hand to wash your armpit. Typically shower, letting water and soap flow over the incisions. Do not scrub them. Pat them dry afterwards and apply a band-aid if desired. Your surgeon will let you know when it's safe to drive because you will be wearing the sling at all times. You may not be allowed to drive for several weeks. Make arrangements ahead of time to have someone transport you to the doctor's office for appointments and when running errands. Patients often complain that right after shoulder surgery, lying down flat to sleep can be uncomfortable. Sleeping in a recliner with an armrest to help position your arm may alleviate the pain and help you sleep better at night. Dressing with one hand can be very difficult. Wearing oversized clothes that you can either pull over or button up with one hand may be the easiest. Be sure to insert your non-operative arm first into the sleeve and then drape the shirt around your injured shoulder. Pull the shirt around and button over the sling. Snaps can be a better option than buttons as they can easily be snapped with one hand. To avoid buttons and snaps altogether, you can wear a large sweatshirt that you can pull over your head and body with your non-operative arm. There are some online companies that make post-operative clothing, making it easier to dress, especially if you don't have assistance. An example of this would be www.shouldershirts.com. Once your surgeon has advised that you can take your arm out of the sling for dressing, start by sitting on the edge of a stable chair. You will adjust your operative arm first. Slide your operative arm into the shirt, first using your non-operative arm to assist. Do not assist with your operative arm. Keep it relaxed by your side. Once your operative arm is fully in the sleeve, use your non-operative arm to bring your shirt around your back and insert your non-operative arm into the sleeve. Do not raise or reach behind your back with your operative arm. Any buttons or snaps must be fastened only by the non-operative arm. Once you have dressed your upper body, place your arm back in the sling. To put your pants on, start by first sitting in a stable chair. Use your non-operative arm to reach forward and grasp the waistband of the pants. Flip each foot into the pants and then pull them up as far as you can. If your balance is good, stand up using your non-operative arm. You can then pull your pants up the rest of the way. If you live alone, you should consider preparing meals ahead of time, something that can easily be prepared. Remember, it is important to eat a healthy diet as good nutrition is important for healing. Please also remember to avoid smoking after surgery, since it has been shown to inhibit your ability to heal the rotator cuff. Physical therapy is a very important part of your recovery. It is imperative that you follow your surgeon and therapist prescribed therapy plan. Timing and physical therapy protocol after surgery varies from patient to patient. Your surgeon will order therapy when it is appropriate for you. Regardless of an open or arthroscopic surgery, remember that the same amounts of repair have been done and the same healing time is required. Allow yourself the time your body needs to heal and recover. Please do not hesitate to contact our office for any significant questions or concerns.